Hello, today is Friday, March 3rd, and I had my second round of chemotherapy today. Went a little bit smoother than the last time, where my port uh, wasn't working, and it didn't actually work today either the way it's supposed to. When they give you chemotherapy drugs, they're trying to get obviously the medicines in, but also they want to be able to draw a little bit of blood out to make sure that it's working. And my port has not done that either time. But last time I had a port study done where they put some dye through uh, the port into the tube, and then they've tracked it to make sure it went where it was supposed to go, and it was, and so they did the chemotherapy. Today, because I'd had the port study done last time, they didn't need to do that again, but again, there was no blood drawn out as there was supposed to be. So again, I am ticking all the rare boxes that can be ticked, apparently. So there's that. Right now, I feel pretty good. Probably because I'm pretty well topped off with a steroid and anti-nausea medicines. So right now I'm not feeling badly after the chemo. I do have a little bit of a headache, and I get lightheaded if I stand up too quickly. And I could feel that even right away when they started giving me the chemo drugs. The first one, the cytotoxin, I had a little bit, and then when they gave me the adriamycin, that certainly I felt the lightheadedness kick in pretty much as soon as they started to inject that. I can see from the video here that the color is kind of drained from my face, and I noticed that after the first chemo session last time too. So I don't look very good at the moment, probably, but I don't feel too terrible. Right now, I feel actually pretty good. Side effects from the chemo that I've had so far in this first 2 weeks, certainly nausea, sort of a bloated feeling in the stomach. Not nausea, maybe not nausea, but queasy, sort of that borderline of, if you've ever been seasick, that feeling you get just before you know you're seasick. It's kind of like, something weird is going on here. That's kind of where I was for a few days. So it was a very fine line between when I could eat and when I could not eat. And it took me a day or two to figure out that I needed to eat really regularly in very small portions. If I got too hungry, that was bad. If I ate too much, that was bad. And I was right on sort of a borderline between when I could eat and when I should not eat. In terms of appetite, after chemo session 1, I didn't really eat very much, like small amounts, but fairly often for about 4 days. So I had it on Friday, Saturday, Sunday, and Monday were not great days in terms of my stomach or my appetite. I felt much better that Tuesday, so on the 4th day I felt really much better. On the 5th day, Wednesday, I felt better than that. And then Thursday was the best day within that week. So I really felt improvement. It took a couple of days for me to be able to feel better and get back towards normal. Toward the end here, the last couple of days, so this week, which was week 2, my appetite largely returned, and I could eat generally normal sized portions at regular kind of intervals. And I actually stopped taking the anti-nausea medicine for the last 4 or 5 days, probably, or at least didn't take it regularly because I didn't need it. So that was beneficial, that was helpful. Generally, I get tired out fairly quickly, so I don't have really much endurance at all. And so Sometimes, not all the time, but sometimes walking up a couple of flights of stairs will be tiring. I just have to go a little bit more slowly than I normally would. I just don't have the stamina or the endurance. Sense of taste, I think that sort of comes and goes, really. I didn't really have any sense of change in my sense of taste for the first few days. And then after a week, I think it did. There were some foods that I could not eat, and other foods that I could eat. Not that I, or not eat, but taste. There were some foods that I could taste. There were other foods in that same meal that I didn't really have any taste of. I knew I was eating them, but for example, pizza. I was eating pizza slices and it just felt like I was chewing something and I didn't have the taste. But when I ate a wing that was mild, I could taste that as if it were a normal wing. So sometimes the taste comes and goes. The next day, I could taste the pizza again. So it's strange. Sometimes I feel like there's a coating on the inside of my mouth, like a film. So I brush my teeth, I rinse out as I'm supposed to with baking soda and the salt solution. But still it feels kind of like there's a film in the inside of my mouth. I don't have any sores or anything like that yet, but we'll see what happens after the second round of chemo. My hair is starting to fall out. Today is the first day that I've noticed the hair falling out. So a few days ago, I started getting, my scalp felt dry and itchy, and then, but nothing really was going on. It just kind of felt like that. And then today, after getting out of the shower, I noticed in the bottom of the tub there was a bunch of hair, more hair than I usually lose during a shower. And when I pulled out, I pulled on some hair. I didn't have big clumps, but there were lots of strands of hair in my hand that typically does not happen. So I can do that. I don't know if you can see those strands of hair or not. The good news is apparently, or it looks like most of them that are coming out are the gray hairs. So I'm all right with that. If I can reverse age that, then, I'm okay with that. But I suspect that's just temporary and it will all come out here pretty quickly. Other side effects that I've had so far, runny nose, that comes and goes depending on the day. So some days I'll have, or even time of day, it will run for a long period of time and then completely stop. I don't feel cold. I don't feel like I have a cold or anything like that. It just, sometimes my nose just starts to run. It's like the faucet got turned on and there's no real seemingly reason for it. And then it stops. So all kinds of weird things going on with the body. I have my patch. So that will give me another injection tomorrow. I had my chemotherapy today, then so tomorrow afternoon, that will give me an injection to help boost my immune system, my white blood cell count, and then I can take that off tomorrow afternoon, late in the day, after it has done its thing. So it will start to beep and make clicking noises late tomorrow afternoon, and then it will actually release the fluid, the hormone, or I don't know what it is. It'll release whatever's in there to help boost my immune system. Now we'll see what the anti-nausea looks like for me this week and next week. I have been taking the anti-nausea medicine today, and obviously had part of it is my chemo infusion, but we'll see if I have the same. Now that I've sort of learned some of the tricks about eating and when to eat, We'll see if I have that. The doctor tells me it will be worse than it was for the first round. I tend to believe him, but hopefully I can manage it a little bit better than I did in that first round. You don't know what you don't know as you're going into this, and so you have to kind of figure that out and learn as you go. So I'll keep you updated with the goings-on of how I respond to chemotherapy number 2, and hopefully things will go here pretty well. Okay, take care, thanks for watching, and I will post updates as I am able. Thanks.